Hi, welcome. My name is Mariana, and Jonathan is the one who is receiving today. And I'm going to show you some Thai massage techniques that are very beneficial for the body, for the nervous system, for the lymphatic system, and they will help you and your loved ones to thrive better in life, to be more relaxed, more grounded, more calm. So first of all, we need to ask the consent for the person to be touched. And sometimes we touch more like places that we normally nobody touch, in between the chest or in the groins. And we need to ask if that it's okay. And if it's okay, we can continue. If they say, I don't, thank you, Jonathan. I know it's okay for you. But for example, if they say, please don't touch my knee because it's very painful, I'm a little bit scared, it's also okay to hear, listen, and acknowledge. So to avoid the part that they are not wanting to be touched. Okay, let's start with closing our eyes and connecting to your breathing pattern. Inhale deeply and exhale longer than the inhalation normally. At the same time, we can tell our partner to do the same. You can inhale deeply and exhale fully and slowly. Feel heavy towards the floor, heavy like water. Try to release all your muscles into the ground. Feel the weight of your bones. And by saying it's already a big step, like they're already getting into it and starting to relax. Now, for the givers, close the eyes and start to heat up your hands. Once it's burning, stop and bring the hands slowly and with a lot of presence into the feet of your partner. Do the first touch, steady and hold with a full grip. And keep the breathing going. It's very important that the person giving it's also very comfortable and relaxed. If you don't feel comfortable at all, you can change position as many times as you need in order to feel comfortable. In the beginning, it's tricky, but later on, you will know which are the best positions that suits you. Right now, with my thumb, I'm feeling his pulsation, his pulse. If you can connect to the fluids of the body, the blood, the water. And when you're ready, you start to go side to side, very gentle, pouring the weight gradually. So imagine that we go from 10 to 1. So we count 10, 9, 8, 7, 6, 4, 5. Sorry. Sorry, let's continue. I missed the math class at kindergarten, but it's okay. So now we start with the thumbing. We move the thumb from the heel up all the way into the same line of the big toe. Let's just work on this line for today. We go down again, heel and up on this same line. And I'm moving from the center of my body, from my belly, from the hara. And we go again into the pouring of the weight. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And other side, same counting, same rhythm. Now we can also think about the layers of the body. We think about the skin, the first touch, the fascia, the muscles, the tendons, ligaments, bones. We normally don't press on the ligaments and tendons, so we can skip that part and we can just think about skin, fascia, muscles, and bones. And this can be our mantra. We can visualize and sense through our hands. This can be a full exercise. You can stay with this layer of palming the feet for about 10 minutes or less, depending on what you're sensing that the person needs. From here, I like to do this shaking, asynchronized, asymmetric shaking. And this is exactly the movement that we're doing. And it's coming from here. It's not just the hands, but it's more of a whole thing. We place our pinky close to the big toe, the starting point of the big toe. And from here, we start to shake. I like to do this to see what is stagnated on the body. For example, on Jonathan, this side, which is the right side, it's completely going all the way up. But this side, it's a little bit more stagnated. I don't know if you can see through the camera, but for me it's pretty clear. Sometimes it's the position of the legs. So on this case, I bring the legs a little bit more close together and I try again. Now it's flowing a little more, but still I sense slightly her left leg a little bit not allowing the energy to go all the way up. But it's much better already, just because of the arrangement of the feet. Sometimes you will see one side is not moving at all. So what, in this case, this side is calling me. And I can start by going unilateral on that side, working unilateral, because we have bilateral exercises and unilateral exercises. But for now, I will start with a symmetric. So both legs. I carry both legs on my palms and I sense. This is already a lot too, to be suspended on the air by, and also held, to be held by someone. This is very powerful. So now remember to feel very comfortable on your body, on your shoulders. If you see tension starting to build up on yourself, change position. Sense through your hands. Now I can do a little bit of internal rotation to shake the legs and a little bit of pull and push. I can help with my belly to go all the way up. And I can stay pushing and creating a little bit of an accordion. And back, I pull all the way up and I start to squeeze, to allow the fascia to open, to allow movement to occur by this shaking. Yeah. From here, bring both legs up. Close and place the legs in my hips, into my hips. This is a little tricky adjustment. So now I have his legs on top of my hips. From here, I'm going to take my butt into the floor. I'm going to do it from this side so you can see. And with the help of my hand, and now I will change sides so you will see the next step. Butt to the floor. I bring the leg into the hip and I take out the other leg into the other hip. And now I'm on a butterfly position. And here I can adjust again the feet and I go. Adjust the hands if they are very close and you are disrupting. And go slowly side to side. Entering with the feet close to the sacrum. This is an advanced move. Right now, I have my feet together. And I have the sacrum on top of my feet. Now I'm holding the sacrum and allowing the sacrum and all the muscles around to melt into the sacrum. It's very releasing. I can hug here my elbows. Remember to be comfortable. If you start to feel pain, get out of the position slowly and in a smooth transition. But here you can stay also if you're comfortable enough. You can give some time for the sacrum. You can bring your attention into his or her sacrum. And you can send love or put an intention for giving in this practice of Thai massage, an intention for the rest of the treatment. It can be presence, it can be gratitude, love, blissfulness, whatever it's on your mind. Keep the breathing going. As a massage therapist, sometimes I think of myself of like someone that is holding the space for the other to let go, to release tensions. It's very mothery also. Our mothers hold us for at least 1 year, 6 months, 2 years, 4 years if you were lucky. They carry us while we slept. And this is very, very powerful for the nervous system. Not to feel this mothery, someone is carrying me, holding me in these places that nobody is holding us anymore, the head, the sacrum. Slowly start to shift the weight between your sitting bones and taking your feet away from each other. If you find a space, a place that is calling you, you can also stay there. Like for example, I sense this place is calling me, I stay. It's a lot about intuition and sensations too. Sometimes we are not right, and it's okay to know that. It's okay to receive feedback from our patients. If something is bothering them or something is feeling off, we should be very open and humble to say sorry, I will put less weight, or I will be more careful. And finally, my legs are completely out of his glutes. From now, I will walk with his leg holding his legs and his legs still on my hips. I'm going to extend one leg and the other, look, I'm going to place my feet down the knee on an internal rotation of my leg. Now, he is very mobile, so this is an option for him to entangle his leg with my leg. But some people, they are not so flexible, and we can keep the leg outside holding the feet. I hold the other leg because holding it's something, and if we have a limb, a hand or a feet to use, why not? So now I'm going to extend my other leg. My heel is close to the ground, very close to the groin, and be careful with the sexual organs. Yeah, we don't want to step on them. So we need to know that we don't need to go that deep. So now I go and press. In this case, I'm going to put the feet here. Extend the feet gently. Now we need to awaken the sensations of the feet. Yeah, to feel, to sense through the feet. This is why also it's very comfortable to ask your patients or friends that you're going to give them Thai massage to wear long pants and like long sleeves or shirts, because we are doing a lot of movements and it's more easy, more comfortable for both of us. So I always have contact with the face of my partner, and I make sure he's not doing sour faces or suddenly twitches. This means that everything is okay. Also, if you are not sure about something, you can always ask. Jonathan, it's okay? Okay. Now I'm doing a little bit more of pressure. I'm pressing, but at the same time, I'm going to the knife of the feet. I'm doing this. I come back and take the feet out. So I go, extend my leg. I feel the skin, the fascia, muscle, and bone. And now I go into the knife of my feet and come back. And again, make sure you're very comfortable on this position. If not, you can get out. Not on an abrupt way, but with a smooth transition. Okay. We can stay here more time, going up and down, up and down. But for now, let's move on. I bring the leg up, place the feet on the ground. And with my knees, I'm going to hold the feet. If I let go, this should go. If it's not going, it means that it's holding the hip flexors. And if it's holding the hip flexors, I help him to let go by moving. And now I check again. Now it's loose. Now I can start to work. From here, we are going to interlace the fingers on the knee and create a line from elbow to elbow and go in with some pressure. And I let it breathe. It's like a breathing. Inhalation, I'm inhaling in and exhaling gradually. Now I can place my chest on the knee and continue with this squeezing of the leg on the inner part and the outer part. This compression is very, very good. It feels really nice. Now, here we have the hip flexors. We are going with the hand like this, both of them, to dig a little bit, to dig and pull towards yourself. And from there, we can start to shake a little bit and do a big pull. When we pull, we can shake also. Let go. Take a lower grip, pull and shake. And let go. Again. Let go one more time. And let go. Good. Now we can continue with the back of the knee. So we have the calves, the twins. Twins because they are two identical muscles like this. And in between there is a delimitation. So we try to go to this delimitation. And from there, place the fingers like this. And extend the elbows and pull. For some people, this is very sensitive area. So you need to first extend the elbows and slowly sense. How is this person on this drill? Because every person will react different for sure. And this is why we need to be open for the feedback. Because there is not a magic recipe for everyone, but the more we listen to the other, the more we can understand it. So I'm going down in between this line of the twins, los gemelos. Yes, and all the way down. Now, the opposite. I was pulling. Now I'm going to push a little bit from the front, only on the flesh. Avoid the bone, but the bone is the guide because I'm pressing between on the sides of the bone. Good. So now we do some circles here of the hips. To one side, to the other. There is plenty of ways of holding a leg. I like to put the back part of the knee on top of my wrist and holding completely the heel, the ankle actually. He's pretty smooth now. He's very relaxed. Some people, they will be not as relaxed. What do we do then? The best thing to help people to relax the musculature is the shaking. So if you find out the person is not relaxed, start to shake the leg. Shake, 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 shake. Okay, let's do the other side. Place the leg, we sit. We open the leg. From here we start the same process. Make sure you're always breathing. With conscious. You're comfortable giving. But to be comfortable giving, we need to be comfortable with ourselves first. For example, if this position is not very nice for you, you can always have props for yourself. You can sit on a pillow so you can be more upright. And also, if you have a movement practice, that will be a lot more helpful because you can gain the ranges of motions and then Your body will feel more free to be comfortable for longer periods on all in all these positions. Yoga is also good as well. Meditation practice, very important. But because when I give a treatment, I normally am not speaking, but I'm on this meditative um, way. Now again, we go into the, I go in, pushing, and now I go into the knife of the feet, go back and out. Last time. I bring the leg up with the help of my feet. Close the knees and see if it's loose. It is loose. I'm ready to work. First grip, interlacing the fingers, and one line from elbow to elbow. Let it go. Now I can go on my toes and put the middle of my chest on the knee. So now I'm holding the chest with my knee. No, sorry. I'm holding his knee with my chest. I'm very funny with words, a little bit dyslexic, but I love me anyway. And always look at your partner's face. Okay, the scooping time is here. Your hands like this. Scoop, dig, dig into these places. Now, rip and pull. You can be static and still, or pulling static, but with a little bit of movement, and then let go. And observe how the skeleton, how it's pulling by me, is pulled by me. So we are pulling in, readdressing, and let go. You can see the connectiveness of the body. Everything okay? Okay, let's go into the calf. Remember this grip. And go. We keep pulling. While we're pulling, we're creating space in between the joints. We are stimulating the fascia, the interconnective tissue, which is everywhere, from the tip of our toes all the way to the tip of our crown, and is connecting us. Sometimes this fascia gets very stuck by trauma, by injuries. And when it's stuck, it becomes hard, hard like rock. But the fascia of the quality of the fascia is soft like water. It's like it can take any form. like the water. If it needs to contract, it contracts. It needs to relax, it relaxes. But when it's all the time contracted, it means that we have stagnation. And by shaking and moving, by addressing the nervous system, slowly, slowly it's going to open up. Okay, now let's go into the circles of the hips. Some people is less flexible, so you need to check what are the ranges of motion. Jonathan is pretty flexible, so I can go a little bit deeper, but I'm very comfortable here holding the feet. I can also be lower on a low kneeling. Later on we will show you like mobility for Thai massage, so you can practice all these positions and get more familiar. And from here I bring the leg down. Okay, thank you for this one. I hope you enjoy, and see you on the next one.